Hi everybody, Dr. Dawn Ross of the Thought Word Academy, but today coming to you just as a woman who is trying to get pregnant again. So here we are. It has been a year straight of losses, and I am very, very hopeful and positive that things are going to work this time. I don't know why, but that's what I'm telling myself. So this time, I just went this morning. I had my baseline ultrasound. There were a couple fibroids there. They have been there since before my daughter was born, when I was pregnant with her, afterwards, so I'm not really concerned about those. I did have a saline sonogram 2 months ago that showed that I had one little tiny 1/2 centimeter polyp. Not terribly worried about that. I've done a lot of research. What I have found is that it doesn't seem to be a big difference between women who have had one small one and have had none, and their pregnancy outcomes. Somewhere between 60% or 50%. It was 10% difference, if that. So, but just to be erring on the side of caution, I went to my Chinese medical doctor and he gave me some herbs that I've been taking. I found some supplements that have been recommended to me as well to shrink any kind of masses. So hopefully that's all kicked in and taken place. I'm not going to do the saline sonogram again to check because A, it is very expensive and of course insurance doesn't cover it, and B, it is very painful. So enough of that. Anyway, just to share with everybody, the protocol is going to be the same protocol that I did when I got pregnant with my daughter. It's going to be a Viagra internally 4 times a day, not a suppository, this is actually pills. Estrace 3 times a day internally again. There's going to be the Vivel dots, which is estrogen patches, 2 times every other day. Doxycycline, which I didn't take an antibiotic last time. I did when I got pregnant, but I mean this last cycle I didn't do because I was sick and I'd already been on something. Also going to be taking prednisone, 20 milligrams a day, LDN, baby aspirin, and prenatal vitamin. Then after we do the next ultrasound, we're going to add in the tacrolimus and the HCG and going to do an intralipids the day of the transfer. So hopefully if all goes well, by next Friday I'll know that I could go and do the transfer the week after. I have 2 embryos left, so I'm trying to be very hopeful that this next one will work. I'm going to start doing castor oil packs tonight, and I'll include a link for anybody who wants to see how to do it from a great site that I found. So to everybody out there, just keep trying, don't give up. Sending you lots of sticky baby dust. Be well, take care, namaste.